Right, hello everybody. Thank you for taking the time to join this webinar. I'd like to hand over to my colleague Maurizio to give some opening remarks before we jump straight into the agenda. Maurizio, over to you.
Good morning or good afternoon, colleagues, and welcome to the webinar of this week. The evolution of the pandemic is going to be subject of an EPI update by Sarah in a moment, but I wanted to have three initial reflections with you. First of all, times are there. We see many countries which are in various forms of lockdown, and the pandemic is moving at different speeds with different effects throughout countries with different health systems. One thing they have in common is the people preoccupation and fear for the uncertainty. So the group, these information that we share every week on mass gathering was moving from far away curiosity in January and February to everybody's being 5 people or 10 or 100 being a mass gathering in different parts of the planet. But these tools and these questions that you will give us is the base for the next phase, when the school will reopen and the society will go back to a normality. And that's when the decision of doing a meeting or not, a football match or not, of that tournament or not, or that religious gathering or not, will hamper the way, and will be informing the way we will live our life in the next weeks, in the next months. One last word on the wonderful help that we are having from everybody, from the FIFA, the players, the NBA, and the religious leaders, that all of them are helping WHO and us to spread the message, making donation, and is a way that the whole sport community is coming together and helping us to make a difference and factually saving lives as we speak. Sarah, over to you.
Sorry, thank you Maurizio, I was on mute. I'll give a very short EPI update, just because I think there is so much coverage of what is going on at the moment that probably what I can say on the matter you mostly already know. Let me just, there we go. So as everybody's aware, we're quickly approaching 500,000 cases of COVID-19 globally. And there are cases in over 200 countries, territories, and areas. So really the whole world is affected in one way or another. We see, unfortunately, that there are over 19,000 deaths now. At the moment, Europe remains the epicenter, with 75% of new cases daily coming from the European region. To date, Lombardia region of Italy and Wuhan, China were the most badly affected regions. However, as we know, this pandemic changes rapidly, and there are certain areas that are showing very rapid increase in cases and mortality, for example, in the cities of New York and Madrid. Within the last 24 hours, we see that the top 10 countries in the world with the highest number of new cases are the United States of America, Spain, Italy, France, Germany, Iran, UK, Israel, Netherlands, and Austria. So still very much centralized within Europe, but affecting other countries and regions everywhere, and changing on a daily basis. So something that our Director General has said, that the pandemic is accelerating. From the time of the first case, it took about 67 days for us to reach the first 100,000 reported cases. After that, it took 11 days for the second 100,000 to be reached, and 4 days for the third. And now, as you can see, we're close to 500,000. And so it really is rapidly growing. In addition to this, we can see across the globe that many countries and cities are in various stages of travel restriction, movement restriction, lockdown in inverted commas, and so billions of people are at home and businesses are affected. So not only, as Maurizio said, is this a public health crisis, but it is very much an economic crisis, and the ramifications are extremely large. So I think that's all I will say for now, and I'm going to hand back to Maurizio, who will take us through the main content for today. So Maurizio, back over to you.
Thank you, Sarah and friends. The expert group, that some of those are online to answer your questions, have been working and producing through and thanks to your input a various form of guidance. Of course, when as I said, when the separation of the mass gathering is 10 people, because we have sustaining community transmission and lockdowns, these are tools that we park in the library and will take back on when the recovery or the different phase is expected. We just finished a teleconference with our WIPRO colleagues seeking the help to the Wuhan community and the whole region to check our newly published risk assessment, which is on the web since yesterday, to be seeing how that can be applied to the reopening of the society when the schools are reopened and the football match are going to be replayed. The same question, we are now having it on the various religious gathering, the various celebration of Easter. We are facing the Ramadan month in the coming soon. So it's not the decision tool for today, which is a different moment of the pandemic, but sooner or later, the society is going to be needing this tool, and we will be having better informed decision and better communication to the public, to the people, on how and why those decisions will be taken, hopefully much more efficiently and better than the beginning in February and January, where some of those decisions were at times less rational than they should. So you see in front of you the various tools. We have frequently asked questions. There are recommendations. There are mitigation and risk assessment in form of checklist, and the guidance on how to use, the instruction for use this risk assessment. Next is going to be a decision flow chart, which is basically linked to the risk assessment tool, but graphically put as a decision tree. And addendums on religious and sports are going to be also offered and attached to this guidance. Next slide. I know one comment back. If you go to the Lancet, and Sarah can distribute the link, the expert group, all of the above, all of these tools has been rationalized in a commentary to the Lancet by the expert group that advises WHO on mass gatherings. And that's where basically you see the overarching thinking of this group and how to position these problem, whether or not to have a large gathering that stresses the system, within a framework of travel restriction, point of entry, societal separations, clinical infection prevention and control, and so on and so forth. Next slide. This is how the risk assessment is based, and this is the flow chart that is the representation, the visual representation of the risk assessment. If Lucia Mullen, which is from the Johns Hopkins Center in Baltimore, one of the WHO collaborating center is online, she could take the floor now and explain a bit more on the thinking and rationale of the tool. Lucia, are you online?
Yes, I am. Thank you very much, Maurizio. So I'm just going to take the next couple minutes to describe in detail a few of these tools, and the first one starting with this interim guidance, which is titled How to Use the WHO Risk Assessment and Mitigation Checklist for Mass Gatherings in the Context of COVID-19. This acts as an operational tool for these mass gathering organizers and really just walks them through the process of using the risk assessment and using the mitigation checklist, the type of information organizers may need to actually answer those questions, and the documents they need to complete this. Both the risk assessment and mitigation checklist, which we'll discuss in a few minutes, are available on the WHO website, and it is highly encouraged that you answer them in the Excel document, as it's pre-calculated to give the scores once you've answered all your questions. What you see on the right-hand side of your screen should be a picture of this decision tree flowchart Maurizio has been mentioning. This is under WHO clearance right now. We're hoping to have it on the website soon. And it acts the same way as the interim guidance. It really just walks organizers through the whole process and is hopefully a more user-friendly and visual approach to do. Next slide. So moving to the risk assessment, once again, this can be found on the Excel document currently published on the website. But what you're seeing here is another user-friendly decision tree that is hopefully going to be published soon as well. Our aim for this risk assessment was to try and keep it as simple as possible while ensuring the questions asked covered all the broad risks. So we had a total of 4 questions that we asked, which included, will the event take place in a host country with documented active local transmission? Will the event include international participants from countries that have documented active local transmission? Will the event include a significant number of participants at higher risk of severe disease, i.e. people with underlying health conditions or over the age of 65? And will the event be primarily indoors, or will people be in close contact with one another for a prolonged period of time? These are very yes/no answer questions, and it should give you a range of risks from 0, which is very low risk, to 4, which is very high risk. Next slide. So after the risk assessment comes what we're calling the mitigation checklist. And once again, this can be found on the Excel document online. There's a total of about 40 questions to this checklist that cover a variety of topics, including ensuring that event organizers understand the current COVID-19 situation. This is especially important as we've said earlier, it evolves so quickly. We also ask organizers about the existence of their emergency preparedness and response plan. Yeah.
Sorry, this is Maurizio here. Of course, if you're organizing a football match in Milano, the organizers are the Milano football team, and they may know the status of that moment in time of the situation in. But some of these mass gatherings are organized by people in other parts of the world. And we will have questions later on the Olympics, of the Expos. So it's important that there is a direct dialogue between the future organizer of events and the status and the capacities of the countries over there on the ground. Lucia, thank you. Go on.
No, thank you very much. That was a very key point, and it is mentioned everywhere in the document, but does value to have it reiterated. Anytime that these risk assessments are being done, they should be done in coordination with public health authorities on the ground and whatever other experts organizers believe they need to be done. It's supposed to be a coordinated activity across sectors. So the other mitigation topics include the stakeholder and partner coordination, the command and control structures that might be in place, the existence of risk communication plans, what efforts are done to ensure that participants are aware of the public health capacities of COVID-19, both before and during the event, and the surge capabilities of the organizers. So each question for this mitigation checklist is weighted depending on its importance in reducing the overall risk. And the answers are tiered from a yes or complete to a maybe in progress, and finally to a no or not considered. Next slide. So finally, all of this is taken together to provide a decision matrix, which provides what you get as the score from the risk assessment and from the mitigation checklist to give you a color determination of the total risk of transmission and further spread of COVID-19 in relation to the mass gathering. This is what we've been referring to as the overall risk score. And as you can see here, we've color-coded it from green to red, with green indicating an overall risk transmission of very low, to red, which indicates an overall risk transmission of very high. So with that, I'll hand it back to Maurizio. Thank you.
Yes, do we have any next slide, Sarah? No.
Nope.
So in overarching comment, this approach is 50% of the equation. So thinking of risks as a global, as a tool to take decision rather than emotions or just something to do. But it's as important as the second half of the problem, which is communicating this risk to the public and to the people. So I'm closing this or limiting this group for 5 people or 20 or 200 because my capacities of contact traces is linked to that number. Or I have to stop this road because otherwise a population which has the disease and one that does not are mixed together. So the explanation on the risk communication of the decision is as important as the decision itself, especially because this lockdown or this moment of the epidemic will pass, and what will remain are the modus operandi that the people are perceived and the way they will behave and listen to the politician, the decision maker, the community leader in the future. I see that Bob Vitillo is online, and Bob is our lead or counterpart in adapting this guidance and this thinking for religious gathering on the planet. Bob, do you want to make a comment at this point on what you have been doing and how you can be helping on that? Over.
Bob, if you raise your hand, I can unmute you.
This whole raising hands in this fascinating.
All right, the floor is yours.
Okay, thank you, Maurizio, and thanks for this update again to Sarah. In terms of the religious leaders and faith-based organizations, we've been working closely with Sarah and her colleagues in another department in terms of developing messaging for the religious world around these issues so that they could spread good factual information and also could incorporate that information into their own decisions. Many religious organizations have closed their houses of worship, even when this is considered extremely rare. It's a first in history for many of these organizations, but they have done it. In fact, just yesterday, the Vatican issued guidelines around its own celebration of the coming feast of Easter and Holy Week that leads up to Easter, and they will not be having public gatherings at the Vatican. All of the celebrations will be done by the Pope alone, and it will be live streamed. Also, in many places in the world, this is happening. But I think it's really important to get these guidance documents that are more specifically focused on the religious world out soon, because many are already developing their own guidances, and I'm not sure that all of them will be based on WHO guidance. So I know that it takes time for WHO to clear things, but I really think we have to move forward and know that we may not have a perfect document. We can update it, but I think it's really urgent for WHO to come out with these guidances.
I can comment this, and I totally agree. It's not just for the forthcoming Hajj and Ramadan and the Eastern, but also we need this guidance. There is a very advanced draft for this, and it's sporting. We will merge them together, and by tonight or to something, we can have some additional question or additional qualification of the general guidance or the tool for the religious and the sporting event. It's not perfect, but also it doesn't need to be perfect, because each country and each event will have its own tailoring required anyhow. So I wouldn't go for a macro level of details, but staying at the middle ground where this general tool can be tailored event by event. Thank you, Bob. Sarah, back to you.
Thank you, Maurizio. I was wondering now if any of our panelists would like to make some comments in response to what you've spoken about and what Bob said. If not, we can go straight into the questions. All right, we have a question from David. Will this risk assessment be a legal requirement, and will any findings be made automatically available to those engaged in work at the gathering, not just the public attending, such as musicians engaged to perform? Maurizio, would you like to delegate somebody to answer that?
No, I agree. I can take this one.
Okay,
what
great.
WHO is mandated to do is to provide the best technical guidance. We can work with the organizer, we can work with the countries and the host, we can develop, tailor the risk together, we can assess the mitigations measure, but we cannot, and we shall never done, decided what and if to cancel an event. So this is the prerogative of the organizer, and we have no mandate to do so. We are in an advisory group, and we provide the best possible science. The decision to cancel or to not cancel, like for the Olympics, for instance, we have been working with them, with the Olympic Committee, to address all of the possible angles. At the end of the day, it was the decision of Tokyo, of the Japanese government, and the IOC, and we supported it, but wasn't WHO decision. Over. Brian, I see you are online. Do you want to comment on these?
I think it will also depend on the legal environment in each country. So, I mean, almost certainly most countries will require that any mass gathering has a risk assessment as part of its normal health and safety process. So I think this would be encompassed within that. And if those are made public normally, then then the extra ones will be as well. But it will depend on the legal framework within which the gathering is held.
Okay, and I see Paul Yan, who is the chair online, our expert, is the chair of the expert group that with Brian that I mentioned before. So it's the whole scientists around the world who author the Lancet commentary, which is online, which represents the forward thinking of WHO, the advice to WHO that the best science is giving to us. So from the legal term, as we heard from Brian, is the countries and the organizer who also bear the liability, the legal or the costs of any event, but also the way the scientific planet or helpers and colleagues help us, the WHO, to build these tools is possibly explained by Paul Yan in few thoughts. Paul Yan? Can you hear us, Paul Yan?
Perhaps we can come back to Paul Yan. We have a couple of questions coming on, just picking up on what you said, Maurizio, about forward thinking. And of course, many questions revolving around prediction of the evolution of the situation. When do you think it's going to be able to hold large events? So along those lines, we have a question from Africa. Can we predict the evolution of the situation in Africa? Are we going to face the same fate as Europe in the coming weeks? How reliable is the data regarding Africa? And at this stage, what about football events in May and June? So a lot of questions in that one. Is there somebody of the panel who would like to take this on?
can start. There is one of the problems that we have in general is that we have, but I really think that Polian and Brian and Crystal can top of that. We have a large set of disequality in the denominators, not being able to know or to have a coherent set of testing in the societies with different phases of the evolution of the pandemic. With a disease, with a virus that is about 50% asymptomatic, you may understand that those countries, of those areas of countries where it seems that it is not there yet, maybe is already circulating. We observed in Italy, we observed in other countries that by the time the bell was, or Iran was, when the flag went up by the number of severe cases, it meant that was the tip of the iceberg of the very, very most sick presenting to the hospital, and in the society was already widely spread. So that prediction of evolution is a combination of health system capacity, mitigation measure, and how much testing we know in the society is occurring. So the fact that you have 2,000 cases now in all Africa may not be the same in 2 weeks' time or in a month's time. For the second half on about the football matches, I believe in speaking with Africa's AFCOM and the FIFA, they are having a severe, very intense rescheduling to show that football is on not just playing football, but having a societal effect and bringing the messaging and bringing the responsibility in and around football. But I leave it to Poliano, Crystal, if they want to add, or Maria.
Hi, Polian here. So two other thoughts on the question about Africa is that I think the trajectory of this pandemic will depend also on the demographics of the different populations. Since there's quite a strong sort of risk factor for age, and I think many of the countries in Africa probably have a younger demographic, but I think it's also complicated by another factor, which is obviously the issue of HIV infection and immunocompromise, and then potentially in poorer countries with malnutrition. So I think there are a lot of unexpected ways. And really the truth is that this is a novel pandemic, a novel pathogen, and we don't necessarily understand how it will progress through different ethnicities, different populations, different demographics, different risk factors. So I think it's important in as many countries as possible to try to slow down the spread and extension of this epidemic, because we're really trying to buy time for the countermeasures. Over.
And one addendum, in Africa, cities or mega cities is different than the rest of Africa. So that's the demographic that Polian was mentioning. Lagos itself, as part of the city, where there are the floating boats, 1 million or 2 living on floating boats, by itself, the isolation is different than a condominium. Over.
Thank you, Maurizio. Bob, I think you have your hand raised. Would you like to comment?
Yes, since the Africa situation was brought up, and especially since Polian mentioned the HIV pandemic there, I think it's important for us to remember that because so much focus is on COVID today, that we already are receiving reports from the faith-based organizations in Africa that they are having stockouts on both the diagnostics and the treatment for HIV. And this will, very much complicate the situation and may lead to massive deaths once again in an area where many, many people have gotten onto the antiretroviral treatment. I suspect this will be the same with tuberculosis and with some of the other pandemics. So I think we also have to understand the vulnerability beyond COVID and also when governments are now working with pharmaceutical and diagnostic companies to only produce, medicines that can at least address partially COVID and to diagnose better COVID, I think, we're leading ourselves into a more complex situation. On next week, we will conduct a webinar with some of the pharmaceutical and diagnostic manufacturers, as well as the faith-based organizations, to discuss this problem. It may not be a total lack of the medicines. It may just be a problem with the supply chains, but we really need to be aware of these things.
Thank you so much, Bob. I believe Brian had his hand up.
Well, just to add on Africa, I think, Poliana set out some reasons why it might be either better or worse in Africa. I think my general view would be the wisest course at this stage is to assume Africa will end up in the same position as Europe, because there's no convincing evidence as to why they wouldn't. And my planning would be based around that assumption. In terms of when it might change and when you can run the football in June or July, I think it's impossible at this stage to say how long this will last. We know some decisions have already been made. The Formula One Grand Prix, for example, have been cancelled through to the middle of June. There will be a decision next week about Wimbledon for July in London. So I would generally think it's unlikely that the situation that we're looking at now will be different in the near future, i.e. through till the autumn.
Thank you very much, Brian. We have another interesting question from Kevin with regards to the resumption of activities and the lifting of restrictions. So once a country appears to have the pandemic under control and decisions are made to start resuming daily activity, is it safe to assume that mass gatherings, such as sporting events, will be among the last things that governments might approve for return to normal? Maurizio, do you have a comment on that?
Thank you, Gavin. This is a brilliant question. We have been seeing that despite the absolute lack of a conclusive evidence that the mass gathering is the driving factor in expanding the virus, in any modeling it cannot be proven, while being at home, locked inside, is confirmed to be one of the drivers. The closure of school and the closure of mass gathering are one of the first decisions that the governments are made on. And this makes reflect, while hampering the society in a very severe way, because taking 50% of the workforce to look after the children is a draconian decision. Wuhan and Singapore shown that with an active contact tracing, with certain measures, you can contain minimizing these long-term effect of the tissues of the society. A football match is not just a football match, it is a celebration, and the players and the FIFAs are really actively bringing this messaging in distancing, in doing the right things at the right time. So I believe that if finally the decisions are risk-based and the decision, yes or no, will be well communicated, I believe that these moments together can be part of a celebration of a new way of living that we will have to face sooner or later, because it's unthinkable that we go back exactly like December 2019 in December 2020. The planet is going to be different. But the model of Wuhan and Singapore, Poliana, maybe you want to add something of what you did or your experience in Singapore.
Well, I think we're in the middle of our second wave. We did manage to survive the first wave from China with travel bans, which were from incoming Chinese tourists, but that was obviously supplemented by China's bans on outgoing tour groups. But we are now in the midst of our second wave, and we've gone up over 600 cases very quickly in a week, almost doubling, because we are hitting multiple waves, including the one from ASEAN, from Malaysia and neighboring countries, as well as the one from Europe and the UK and the United States. So it's really a summation of multiple waves. I think we will see, as we did in the 1918 pandemic, multiple waves going around the world. And I think it will be different for different countries depending on travel patterns and demographics. But so far we are ramping up the contact tracing. We're moving the isolation out of hospitals into community isolation facilities. So the young ones who are going to do well, regardless, we're moving out of the hospitals so that we can conserve the hospital capacity for the sicker ones and the older ones. So far, we've been holding our own, but we recognize that the most important rate-limiting factor is intensive care unit capacity. So the number of cases will determine the number of ICU cases, and that's why we're squeezing the bottle so hard up front in terms of trying to stop transmission. So that's kind of where we're at right now. We're still holding the seawall, but we sometimes feel like the sea is about to come in. Over.
Thank you, Polian. I'm going to hand over to my colleague Rosamond, who'd like to make some comments on this.
Hi, thank you, Maurizio and Polian and everyone. I'm intrigued by this.
Rosamond, thank you.
Yes, you're welcome. Intrigued by this conversation and be interested to turn back to you also, Polian, in a moment about what Singapore has decided to do about schools. As what I wanted to say was that for all these measures, whether it's mass gatherings or family weddings or schools or workplaces, we're actually now trying to stay away from the terminology that implies complete closing down, shutdown or closure of physical buildings, because I think invention, what's the expression? Necessity is the mother of invention. And we've seen very quickly workplaces, schools, going to teleworking strategies, teleschooling strategies, distance learning for universities, whatever language we had before. These things have ramped up at such an incredible pace. It's true that we are in the middle of Europe and that not everywhere will technologies be available, but technologies have always existed, whether it was smoke signals or whether it was radio or whether it was television, for people to communicate. And there's no reason why even a school for which the building has physically closed or which is only open for children of healthcare workers, which is another adaptive strategy, there's no reason why in these situations, even in lower resource settings, they can't have radio broadcasts, community television broadcasts for different age groups, different classes, that kind of thing. I'm just imagining that they will be as creative as have the Chinese been and other countries in the Western Pacific, as well as now we're finding European countries and North America. So it's important that as we consider this group that you are has actually led the way in terms of formalizing the risk assessment and adaptive strategies. But even I see now children are being invited to participate in all kinds of online football events. So these are adaptive strategies which will help see people through so that these social and physical distancing measures, of which mass gatherings obviously is one, don't lead to societal breakdown, because people are very concerned about the downsides of all of this, the implications for food supply, the economy, jobs and everything. And we can't save everyone in terms of their jobs and all of that, but there are many adaptive strategies that can be taken at the very local level in terms of detailed risk assessment and finding new ways of doing things. And of course, governments are also stepping in to provide social packages to support their populations and their residents through this time. So I just wanted to add that these don't have to be binary. It's not yes or no, as you know already. It's adapting the way we do things, whether it be school, work, or anything else. And of course, preserving essential services, including hospital and clinical care.
Thank you, Rosamond. We have another couple of questions coming through with specific reference to the risk assessment. Eriketti asks, will the event, on the fourth question of the risk assessment, you ask, will the event be primarily indoors and or will people be in close contact with one another for a long period? How do you define a prolonged period? Maurizio, over to you.
It's more for Rosamund, but after this question, I see that there is Bill Reich in online. If I ask you to untag, I'm allowed to speak, because the one sector that has been touched on the periphery of those conversations is the industry and the business world and so on, which is in a sense one of the problem and or the solution. Now with the lockdown, there are no goods that goes around. On the other hand, that is soon is going to be part of the solution of a new way of doing trade and commerce and moving goods. But for this very question you mentioned, I have to pass it to Rosamund. Rosa?
Sure, thanks. Well, it's difficult coming up with a definition of prolonged, but in the context of COVID-19, what is being floated as a proposal, and some people are using it as a definition, is the idea that you're in face-to-face contact with someone in intense conversation, or at least close enough to be having a conversation for at least 15 minutes. Now, again, this is a balance, right? What it really is the risk. If you're passing someone in the street and you pass within 2 feet of them, but you're not looking them directly in the face and they're not coughing, then the chance of getting infection through that route, even if you're less than a meter apart for a very short period of time, is negligible. If you're having an intense conversation with someone who's across the table from you and you're leaning in because the music is so loud that you can't hear anything, and that conversation goes on for a bit, then obviously you have an opportunity to exchange droplets, let's put it that way, and reach out and touch each other's hands. So, in the context of mass gatherings or events or activities, it's the same. It's kind of a risk-based thing where if you're in a crowded stadium, you're obviously yelling, shouting next with the person next to you. So basically the cutoff has been set at 15 minutes, but it's a question of common sense and judgment. And for sports, it's the same. Contact sports, you know, tennis may not have the same risk as football or other contact sports. So again, it's about the amount of time that people are spending in close together, even if it's in the sports field.
Somebody can argue that cricket, a game that lasts 5 days, is a longer exposure than 7 days rugby, 7 people rugby, which is only 7 minutes. Over, Sarah.
Thank you, Maurizio. Who was it that you asked me to unmute? Was it William Reich?
William Reich. Can you hear us, Will? At the very bottom of the list of the attendees.
William, you are able to talk now.
How about now? Can you hear me now?
We can, thank you.
Okay.
Thank you.
And can you, certainly wonderful to hear you all. What was your question, Maurizio?
Basically, you are in contact with the universe of business and the large corporations, and how are they talking and taking about this acute moment, of course, in lockdown, but what plans they have to help those topics as soon as the peak is going away? Over.
Sure. So we have a large outreach to multinational corporations, and obviously with presences across the globe. And in large part, what's happening right now, clearly these are uncharted waters. So in most cases, we're doing similar to what you're doing here with regard to maybe larger mass gathering groups. Much of it, the issues right now are benchmarking. So on a weekly basis, we are pushing out surveys amongst the various corporations. They are asking each other, what are you doing? Everything from travel policies to how are you cleaning your own facilities? What are you doing relative to visitors and the like? In most cases, obviously, their facilities are closed down except for absolute essential staff, IT, you know, and the like. And to the extent possible, most players are obviously working from home. The larger corporate community is looking for various triggers. They are certainly making some decisions on their own, but they're looking predominantly to authoritative external public health, certainly WHO, in the US, CDC, and looking for advice. They are trying to translate much of that advice, certainly from a wider public sector perspective to their own operations. Within, I think most societies, we're getting a differential between essential services and those that are considered non-essential business services. Those folks are weighing that out, and in most cases, I think we're quite cognizant of the fact that this is all best approximations to general policies. And as has been mentioned, relative to specific countries and their own instances, in like manner, each of these larger corporations have presences across multiple jurisdictions with differing public health restrictions. And they are wrestling with the inherent challenges of developing something in the way of quasi-uniform policies that still take into account the factors that they have operations, again, in these jurisdictions, whether they be country to country or even in the US, state to state, or in some cases, municipality to municipality.
Especially because most of these corporations are multinational, so they have branches in the rest of the planet. That's
Yes.
very, very helpful. Thank you so much, Bill. Sarah?
Thank you, Maurizio. Do you feel that we have time for a few more questions, or how would you like to take this forward?
I think we can take another couple of questions.
Okay. Great. We have a question from Christian saying, how is the increasing number of recovered and potentially immune people having an impact on the risk assessment for small and mass gatherings? Is there a threshold or tipping point that would change the situation?
Can you unmute Christian Hagen-Miller? Because he should be part of the panel. He's one of our experts, especially in the third pillar of the specialistic, the impact on security. Remember that the security component, the people, the policemen, are not just there to enforce the quarantine, but they can also be the part of how they should protect themselves and how shall be the positive messaging. It's not true all over the world at the same time. In Italy, when they say go left, the police, you inclined to go right. In UK, they are inclined to follow. And the rest of the planet has a different relation with the security sector. But we cannot ignore as one of the main players, especially in gatherings. So if the immune people having an impact on the risk assessment is going back to what Paulian and Brian said, is the exposure time and the fact the gathering itself is not just the time you spend at the stadium, but the subway to go to the stadium, and is outside, outdoor, indoor, is tennis versus indoor, skateboard, where the whole population will be youngsters. So these are the considerations that you have to have ad hoc. But in general, the science, mass gathering medicine, refrains from giving a number. Because the G7, G7 is a mass gathering, because there is 7 people talking and a huge number of people in the street. Over.
Christian, would you like to make some comments?
Well, I have to admit that I didn't got some of the initial questions, so because I was not only muted, but also the audio didn't work. But coming back to my question, I don't know if you answer that. It is just I see the potential of having recovered and immune people that we can use as being in the front line of, let's say, in dealing with in some points, let's say for checkpoints or for in dealing also with patients and so on. So I'm just asking, how do we consider that kind of increasing population in the risk assessment, because we will have a point where we will have so many, let's say, recovered and immune people, and so that the risk assessment will probably not apply for the most of the people. So there will be a tipping point. You're just looking a little bit in the future. So talking maybe in 4 months from now. So we will certainly have a couple of million already infected and have being immune by that. So this is just let's say a kind of thought that I had, and I didn't want it to let's say to provide any kind of let's say confusion in that.
Thanks.
Thank you. I think Rosamund can speak to that a little bit.
Yeah, thank you. As groups or countries begin, the very first ones to start to recover from this, these questions are coming up, and there's a couple of, it's a very good question as to whether this could be a strategy. There are many aspects to consider before we can go there. First of all, the development of a test to assess immunity. We don't know yet if this coronavirus will induce immunity in everyone or in some people, or what proportion. We don't know the duration of that immunity, whether whether it's a cross-covering with other coronaviruses or whether it will be short-lived. There's many things that we don't know, and we won't know for a while. Partly because the tests are under development now. Now they are already being checked or tested in the general population, but they will be cheaper, they will be easier to access, they will be easier to produce in large quantities. So serological testing is a question that's coming up, but we're still waiting for the test to be confirmed. We're still waiting for information. And as to the duration of immunity, well, that obviously we will only know, sometime after, like a year after someone's been ill, whether they've still got immunity or not through a certain test, which may not give the complete answer. And then the final thing is that, as we know now, we know that the number of reported and confirmed cases, certainly does not represent the number of people in the populations that have actually had the illness. And so on the one hand, we may not know who has actually been infected with this virus. And on the other hand, we also don't know if someone who's had very mild symptoms will remain immune afterwards. So many questions on the scientific side that will of course have to inform these strategic and tactical questions, which are very important as well.
Thank you.
I think, and my final reflections to be shared, is that most of the questions we received today are going to be informed and answered and compiled, but the thinking on how we will use these tools and this thinking for the positive of the planet to have these new bubble phases and emergencies matched with less fear now that we know the beast, and how to have a positive impulse, a positive development to grow back into a life together. And definitely mass gathering, religious, sport will be in the center of our society as it was before this testing and dire moments. Sarah, back to you, and thank you for organizing this webinar as usual. I found it very informative, and we will the same time and venue done for next week. Sarah?
Thanks. Sarah's had to leave the room to prepare for the next webinar in 5 minutes. Oh, she's back. I don't have to say goodbye on your behalf. Go ahead.
La Sarina.
Apologies for that. I have a number of competing demands. All right, so I just wanted to say thank you again to everybody on the call. Thank you to the panelists. Thank you for the questions. If you do have other questions, you can feed them through to us on the EPI-WIN email address, and we will try to add them to the Q&A that's already online that Maurizio and his team developed. Yeah, that's all I have to say now. Thank you so much for your time, Maurizio.
And all of the panelists and team, and for all of you for your time and questions. Bye. Ciao, ciao.
Bye-bye. Thank you.